Doctor of Pharmacy degree from Howard University. She got her Bachelor's of Arts in Biology from UNC Greensboro, and she now works at Encompass RX, which is a CVS specialty pharmacy. Her hobbies are that she enjoys gardening and walking her dog Kingsley. And a fun fact, she is a West Charlotte graduate for my Charlotte graduates, or my Charlotte students here, along with myself, both West Charlotte graduates. So with that, we're gonna say hello to Dr. Townes, if you can join us on the screen as well. Oops.
Hello, everyone.
How are you today?
I'm doing well, thank you.
Excellent, excellent. Can you tell us a little bit about what we're gonna be doing this evening?
Okay, sure. So basically tonight, you're gonna get to know me inside and out and what I've been doing for the past 20 years. What is a pharmacist? Why are pharmacists important? I'm going to tell you all about the different fields you can go into when you choose pharmacy. We're going to explore what goes on in a day for a pharmacist. We're going to review dosing and drug reactions while learning how to fill prescriptions. We're going to also talk about dosing calculations and how to calculate a dose for a child. I'll discuss counseling pearls and why that's important, and why medication adherence is important as well.
Excellent. So we have a lot of exciting things to cover. So let's jump right into it. All right. So, Dr. Townes, you want to ask this question?
Sure. I want to know, can anyone in the chat tell me how many pharmacies you pass on your way home? How many do you see on your way home? And also include the name of those pharmacies too.
2, 3, 0.
Somebody put 0? CVS, Walgreens, yes.
Mm-hmm.
Okay. So just about everyone. So that tells you that pharmacies are everywhere. So guess what? When you're a pharmacist, that means you have a lot of opportunity. That's job opportunity. So no matter where you are on the globe, you're gonna find a pharmacy on every corner.
Excellent. All right, so tell us, what is a clinical pharmacist and what inspired you to go into the field of clinical pharmacy?
Okay, well, as you know, pharmacists are drug experts. However, clinical pharmacy takes that knowledge and apply it in a clinical setting. So they're going to be a part of the healthcare team to ensure that we not only give you the medication that's prescribed, but we want to optimize the use of it and make sure we have positive clinical outcomes for every patient. So we take it a step further and really work with the healthcare team.
Absolutely. It's a huge teamwork, dream work situation. Yes. So what challenges did you face along the journey to becoming a pharmacist?
A lot of different challenges, but really what inspired me to become a pharmacist, my first job in high school was a pharmacy technician. So after so many years of working side by side with pharmacists, that inspired me to, want to learn more about the medications. And I then decided to go on to pharmacy school. Once I got to pharmacy school, doing the pre-pharmacy work was very challenging. I had an advisor that basically told me that I didn't have the right grades. I didn't have straight A's. However, one thing I did have was experience. So I did not let one person, which was an advisor that didn't really know me, tell me that I couldn't do it. And I had friends that were pre-pharmacy with me that actually changed their major over to computer science. And now to this day, they tell me they regretted that they didn't stick with pharmacy. So I'm so glad that I didn't listen to the naysayers and I kept pushing to fulfill my dreams.
Absolutely. That's so important, especially because when you're in college, you are looking to your advisor for support. So for having, to be able to go through that and the adversity of that and push through is really important, an important lesson for you all to keep in mind as well. So thank you for sharing that.
No problem.
So tell us, what are some of the joys of your job?
I'm a people person. So being able to be on the end that help people get better. When I've worked in so many different pharmacy atmospheres that I've worked with, children before in a children's hospital where I would deliver medications and see very sick children, sometimes alone if their parents went home for a break. So just having the joy of being able to give a rare medication to a kid that's suffering, that's always been fulfilling. I worked with military people that were going off to different countries to serve and get their prescriptions ready for them. So those are that's a fulfilling thing when you know someone needs you and you can do something to help them.
Mm-hmm. Absolutely. So tell us a little bit more about, you already mentioned being resilient.
Yes.
What are some other characteristics that make a successful pharmacist?
I think the main thing is determination. You have to be smart, but it's something that anyone can learn. I had to take a lot of science, a lot of math. So there are times when I had to just step up my game and study very hard in very difficult topics that I didn't understand. So I would just say, if you have the determination and you're willing to put in the work, that's what makes a great pharmacist. And we do work long hours. We do have to care about people. So you have to be willing to give your all to people 110%. In healthcare, we oftentimes have to defer our holidays, sometimes our weekends, because, sick people is 24/7, 365. So you have to really be flexible with your lifestyle and really be able to give it all to healthcare because people need us.
Mm-hmm. Absolutely. So it sounds like being able to communicate well, being flexible in your time and in your schedule, and then really dedicated and hardworking, so you can accomplish getting to the field and working in the field on a daily basis. So
exactly.
Mm-hmm. All right, so we are going to jump into our stethoscope case files, and I will let you take it away.
All right, so we're going to, put on our white coats now. And we're going to look at a case where we have a child named Jimmy. He's a 2-month-old boy that weighs 12.25 pounds. He had, for 3 days, fever and ear pain. He was seen by his pediatrician, Dr. Weiss, and was diagnosed with an ear infection known to us as acute otitis media. Miss Bravo, his mom, is at the pharmacy waiting for her son's prescription for a 10-day course of an antibiotic called amoxicillin. So walk through with me what it takes to get Jimmy's amoxicillin prescription prepared and ready to go.
So we got a question for you guys. What do you think happens once Dr. Townes gets this prescription from me for this ear infection? You can drop it in the chat or you can unmute yourself.
Okay.
History.
That's true.
Okay. Other thoughts?
Fill the information on the system. Yes, we do have to do data entry. It's very important.
Mm-hmm. All right, we'll keep going. Let's see what happens.
All right, so far so good. So we're going to actually review the prescription first. So we have to take a look at it and make sure I have everything I need to fill the prescription. So we're going to take a look at the prescription itself. Okay. So what's on a prescription? You have to have patient demographics. We have to know who we're filling for. So demographics would be their name, correct spelling of their name, their address, and their date of birth. We also have to know the name of the medication. You'll be surprised when doctors are rushing. They got back-to-back patients they have to see. Sometimes they leave off the prescription name or strength. So we have to know those things. We also have to know the different dosage form, the medication strength, the units of the medication strength, the weight of the patient, how it's going to be dosed, how often it's going to be dosed, and that's called a frequency, like twice a day, if it's going to be taken by mouth, because medications can be instilled in your eye. Amoxicillin can, there's eardrops, there's oral medication. So we have to know exactly what dosage form we're working with and for how long we're treating. So those are the components you'll see on a prescription.
Right, so we're going to step through each of those.
Okay. So how do you read the prescription? So if you look at the very top, I do know where the prescription is coming from. I always want to make sure I have a legitimate prescription. So you're always going to have the doctor's information on there. I'm going to be checking for the name, the date of the prescription, because some prescriptions, depending on the drug that's being dispensed, has an expiration. So if it's not a scheduled drug, which is somewhat of a habit-forming drug, most prescriptions can last a year. So I would have to have a date on the prescription, as well as the demographics and the drug allergy information for our patient Jimmy, because I don't want to give Jimmy amoxicillin if he's allergic to things like penicillin or anything that has a similar chemical structure to amoxicillin. I want to make sure there's not going to be any cross sensitivities. So I do have to know his medication drug allergy profile.
Mm-hmm.
So on here, you'll see the strength, which is amoxicillin. This is 250 milligrams per 5 ml. So as you can see, you have to know mg, which is milligrams. You have to know the units ml, which is liquid form. You also get to know what dose the doctor's looking for. So in this case, the doctor wants 90 milligrams per kilograms, which is his weight in kilograms, and that per day, and we're going to divide it into BID. Does anybody know what BID means? And it's kind of a clue in their word bi, which means 2. So that's twice a day. And then we have the 4 10 days, which is the duration of the medication.
Mm-hmm. And I'm just going to jump in here for a second, because we choose our dosing strengths for reasons, right? So not all amoxicillin doses are 250 per 5, and not all doses are 90 milligrams per kilogram per day. So we chose that on purpose because for ear infections, that's the best dosage strength to make sure that we get the medication into the area, into the ear canal. Same thing when we have pneumonia, we dose it this way too. So we all work together. And so this prescription, I have to write it one day, and then Dr. Townes has to make sure it's correct. Because as you said, we're sometimes rushing even when we're typing things in. So it's a huge teamwork effort. So we're gonna share a little bit more about it. We talked a little bit about this already, the dosing frequency, and then we talked about the duration.
All right, so if you see here, we have the same prescription side by side, but the prescription on the right, based on the information we provided on the last slide, it's missing something. So can anyone tell me what's missing on the right, on the prescription on your right?
Mm-hmm.
Right, and somebody said it, the BID, and that's also known as the what, she showed it a few minutes ago, that's the frequency, how often, because sometimes it may be dependent on the medication, it could be once daily dosing, twice daily dosing, 3 times a day. I have some prescriptions, not necessarily for amoxicillin, that's taken once weekly. So depending on the medication and the indication, which is what we're treating, we have to know the dose frequency. So very good to catch that. And so that's what a pharmacist does. We have to be real detail oriented on every aspect of that prescription, because if we get it wrong, then we don't optimize the care. A person can have a prescription and not use it correctly and not treat the infection. And in Jimmy's case, right now it's localized, it's an ear infection, but if I don't dose him right, I give him the wrong medication, that can then become another problem. And we're trying to avoid that. So that's the importance of a clinical pharmacy, because we're trying to not only dispense it to you, we're trying to optimize that therapy for that positive outcome that we need, which is to get rid of the bacteria. So let's go talk a little bit about, we're going to shift gears and talk about calculations. So we're going to learn how to calculate a dose of this amoxicillin. And believe it or not, this is basic math that you may have learned at the end of middle school, going into high school. So when you're learning stuff, you might not think it's important at that time. If you're a college student, your freshman year, the math you've had to learn, but it connects once you become a professional. You get to use everything you've ever learned in math, especially in pharmacy. So as far as the dosing calculations, I have to make sure, number one, I have the right drug. So there's so many different dosage forms of amoxicillin. It comes in different strengths. So I do have to check to make sure I'm pulling the right bottle off the shelf. Also, after I reviewed the prescription, I know this patient is going to take the prescription for 10 days. So when I'm doing my calculation, I have to make sure that I'm giving him 10 days worth of medication. And then also with the dosing, this is a child. So with children, their doses are a lot smaller than adults. So I have to know the weight because the doctor gave me the dosing in kilograms, and I know it's weight in pounds. So that means I got to do some conversions here. And so we'll talk a little bit about how to convert. Does anybody remember how many pounds are in 1 kilogram? It's on the screen.
I gave it away already.
Put it in the chat. I want to make sure everybody know that conversion. 2.2. Exactly. So for every kilogram, you have 2.2 pounds. And we know Jimmy was what, 12.25 pounds? So we have to convert that. Next slide, please.
Oh, you want to...
do the calculation before? Is this on the next screen? Okay. So if you can help me figure out how many kilograms now, how many kilograms is 12.25 pounds? Can anyone do that calculation? Can anyone do that conversion for me? Because we know his dose is 90 milligrams per kilogram per day. So how many kilograms will that be if he weighs 12.25 pounds? If you know it, please put it in the chat.
No, asking Google. No, I'm just kidding.
And this is like, okay, very good. So Jalea, how did you get your answer? What did you do with the 2.2?
So I just set up like, I don't know what this is called, but it's where you like make the fractions like 1 kilogram per 2.2 pounds, and then set it equal to like X amount of kilograms over 12.25 pounds, and then like cross multiply and solve for X.
So when you cross multiply, you ended up dividing that 12.25 by what? 2.2, right?
Yes.
Exactly. So I just know, because I've done this for years, anytime I'm trying to convert to pounds to kilograms, I just divide by 2.2. So you just know that after a while. Divide by 2.2. Very good. All right.
All right, so then we're gonna go to the next step. So if we're gonna use the weight to dose and get the total daily dose, Townes, you wanna take us through that?
Okay, so yes, so now we know that we have to get the total daily dose for Jimmy. So we have 90 milligrams per kilo. So if we know now we have 90 milligrams and we have 5.57 kilograms, what's going to be the total daily dose for Jimmy to take? So for every kilogram you have, which you have over 5.5 kilograms, you're giving him 90 milligrams. So how do you do that calculation?
I'll give you guys a few seconds.
So for every kilogram, you're giving him 90. So if I got 5.5, then how many total milligrams will that be for the entire day for Jimmy? And it's okay if you don't know. That's one thing you have to learn in pharmacy. When you don't know, you say you don't know. Okay, somebody got it. So Pristine, how did you do that? What did you do?
I just multiplied the 5.57 kilograms by 90 milligrams.
And that's the total daily dose. That's it. That was what? When did we learn that, guys? What? 7th, 8th grade? It's easy. But now it's applying it to real life. And that's what all these crazy things you've had to learn in school, that's where it comes down to those basic fundamentals to get stuff like this. So now we know Jimmy has to have around 500 milligrams per day of amoxicillin. But if you remember the frequency, how often did they want to use it? Does anybody remember what BID was? Twice. So we have to divide that by 2. Because if we do 500 twice a day, then he's going to get 1,000. We don't want to give him 1,000. We want him a total daily dose of 500. So we're going to just chop that in half and give 250 in the morning and maybe 250 milligrams in the evening. Okay. All right. So here we have our prescription bottle. And we'll go through how to reconstitute and all that in just a minute. But how much is needed for him to take half in the morning and half at night? So if my strength of the prescription is 250 milligrams per 5 mLs, I can't tell Jimmy mom to give him 5 mLs. What unit or what measuring tool will just a layperson know? Instead of 5 mLs, it's also known as what? It's on the screen. Teaspoons. Okay, very good. So that means for every teaspoon, Jimmy's going to get 250 milligrams. So that means that I have to counsel, and I'll give them measuring devices because sometimes people don't use the right spoons from their kitchen. So I have to give measuring devices too. So I'll give mom some oral syringes just so she'll be able to either measure 5 mLs or be able to measure teaspoons. Okay, so 1 teaspoon twice a day will give him the total daily dose of 500 milligrams. And it's very important that I also note that I give him enough of the prescription as well so that he can have enough for the whole 10 days. Okay.
Has anybody taken amoxicillin before when they were a kid? Do you remember what it tastes like? Most of us have tasted this at some point in life. Yes. Can somebody tell us what the main flavor is? Disgusting. Yeah, that's a good one. What else do you? Oh, okay. Allergic to it. Okay. Tastes like bubble gum. That's what they tell you anyway. That is, right. You use that. You tell them it tastes like bubble gum.
It does. And why is that important? Why is taste so important for a child? A bitter, sweet, very sweet. So we want the kid to take it. So I can dispense amoxicillin all day long. If it doesn't taste good for a child, what are they going to do? They're going to spit it out. They're going to throw it up. And how am I going to get optimal care if it doesn't taste good? So over the years, we've had things like clindamycin, which is something that's not going to come in bubblegum flavor. And we have to actually flavor it. So we have flavor formulations, drops of sweeteners that we have to add to make medicine palatable, make it taste good. So that's all, it all helps with adherence to these regimens. Because again, a doctor, once they leave the doctor's office, it's up to me to make sure the person is treated, get the right drug, but to also take it. So coming in bubblegum flavored, that helps them want to take it. Actually, some kids look forward to taking it, and it helps them to stick with the regimen, and stick with the adherence of the medication. And somebody asked, does it mess with the medication? No, it doesn't. We formulate it where it will not mess with any part of the concentration. It's only there as an inactive ingredient, which is just to add flavor. So no, it will not. But we do have to use if we do it on our own, compounding it into a flavor, we do have to follow formulas that's been tested and assured that it will not mess with the concentration. Great question. So let's review. I know we've said a lot these few minutes, so let's just review the drug label now. So when you see the drug label, when mom gets it, it's going to always have the pharmacy that it came from. So in this case, iDream Pharmacy. And we're not going to call it amoxicillin tonight. We're just going to call it a Kool-Aid oral suspension. But as you can see, the strength is on there, as well as the dosing directions. And you also notice the word by mouth. And I don't know if you know why that's important, but because drugs come in so many different dosage forms, people sometimes, believe it or not, can be very confused on where the drug goes. So it's very important for us to put by mouth on there, and then also include the 2 times a day and the duration. So the frequency and the duration, as well as the correct amount. And of course, it's a 100 milliliters, because we know he's going to get about 10 mLs a day for 10 days. So that's going to equal the 100 milliliters. And generally with antibiotics, there are no refills on it, because we hope within that 10 days, the respiratory infection is cleared up. And if there needs to be refills, sometimes the doctors will want to see the child again to maybe try a more aggressive treatment. So they may have to reassess. So that's usually why they won't put a refill on it. It has the fill date on it, because once I reconstitute this prescription, because when I get it off the shelf, it's just a powder. And I actually have to mix it, which I'll show you shortly. And so I have to put an expiration date. And normally when I reconstitute antibiotics, sometimes they last 10 days, sometimes they last 14 days. So knowing the date that I filled it will let mom know when the expiration is. And then 2, who prescribed it. So if they need another refill, they dropped it all, and we have to call in and get another prescription, we want to know what doctor we need to reach out to.
Ready?
All right. So making the medication suspension. How do we do it? So I'm going to demonstrate just how we do it. So what I've gathered is a Kool-Aid packet, and you can do this later, this weekend if you want to try it, but you'll just need a Kool-Aid packet, water, a syringe, something to measure with, an empty container. I have a bottle, but you can use anything, just to practice with. I use tape to represent the label, and a marker to kind of write what would be on the prescription. So I'm going to take my background off because it's hard to see my hands and me moving. So I'm going to take my background off so that I can show you how we do this prescription.
Can you see Dr. Townes pretty well? Yeah, okay, excellent.
Okay, can everybody see me?
Mm-hmm.
All right, so I'm taking amoxicillin off the shelf. So this is my bottle, and just imagine it saying amoxicillin 250 per 5 ml. And so you can't really see it, but there is the Kool-Aid in the very bottom, which is going to be representing the amoxicillin active ingredient. So most of the times with stuff that you have to reconstitute, it will be a just powder in the bottom, and I have to add distilled water or purified water to do the reconstituting, to make it into a suspension. So in most retail pharmacies, you're going to have an apparatus maybe near the sink that actually can measure. It's almost like a automatic graduated cylinder, you can say how much you need and then it comes out. So in this case, I'm gonna manually do it. So I have my purified water as well as my graduated cylinder. And so normally on the stock bottle, it's gonna tell you how many mLs to add to the amoxicillin. So tonight, for just experimental purposes, I'm gonna add about 70 mLs of water, okay? So got water in here already. So I would just measure with my graduated cylinder. So anybody who takes science classes right now, you're gonna measure out your water in your graduated cylinder. And it's important that you do the right amount, because if you go over that amount, then you're diluting it and it's not gonna be that concentration that you need. And then if you go under the amount, then it may be too strong. And when it's not mixed right, people can have side effects from the medication. So it's very important to read the side of the stock bottle to see exactly how much water is needed to do the reconstituting, okay? So then I'm going to take my stock bottle and I'm going to just put half of it in here because I want to wet the powder first. That way I know that my water has been evenly distributed within the stock bottle, okay? So I just put half of it in there, and now I'm going to finish off with the other half. And I hope you guys can see me okay?
Mm-hmm. You can lift it up a little more.
Okay.
Mm-hmm.
So can you see it? Okay.
Yep.
So put all of it in there. And then I'm going to put my top back on. And this is a child-proof top for it so it won't spill, number one, and so the child can't get into it as well. So because it's a suspension, I want to make sure the drug is evenly distributed. So I want to shake it well. Shake it well. And not everything in pharmacy has to be a rigorous shake, but with this suspension, yes, we do have to shake it well. Okay. And then there you have it. We have the amoxicillin, 250 milligrams per teaspoon for Jimmy, okay? Simple. And normally in a pharmacy, I'm gonna have my technicians do all this. Those are my assistants that will get the drug ready, and they just will show me for verification to make sure that they use the right drug. So I will check it, but most of the time you're gonna have assistants in there that's gonna do the legwork for you, and I can just visually check it, and I can get ready to talk to Jimmy and his mom instead, okay? All right, so that's all we do for the final results for the amoxicillin. All right. So if you try this at home and you need to write out your label, you also want to just make sure that everything we talked about is on there. So the pharmacy name would be on there. As you can see, there's a prescription number. Every prescription is assigned a prescription number, so we can identify it, or if there are refills on something, we can refill it. It's also going to have a date, the patient's name, because again, it's not for anyone but Jimmy Bravo, so we want to make sure the right person's name is on this prescription. So if I put the wrong person's name on it and I'm dosing it and filling it for the wrong patient, that's what we call a misfill, and I would never want to misfill a prescription. So even down to the person's name, it has to be just perfect, just right. And then the dosing directions on this one, this example, it says 3 times a day until gone, but for Jimmy, I would type, of course, twice a day for Jimmy, and it would be 1 teaspoon. Twice a day for Jimmy. And the directions, the medication, the right strength would be on there, the quantity, which was 100 mils, and then no refills for this prescription. And then at the bottom here, this blue thing that says shake well and keep refrigerated, that is called an auxiliary label. And sometimes patients have to know how to store it at home. And because You have a powder now suspended in a liquid. That's why you always have to redistribute the active ingredient within that suspension. So shaking it well is so important, because you don't want the active ingredient just sitting at the bottom, and then when the parent tries to draw the medication out, they're not getting active medication. So you always want to shake it well and keep it stored properly so it can last, okay? So that's some other dosing instructions we use called auxiliary labels. Next slide. So now we're going to talk about counseling pearls. So in the chat, can you tell me what should I discuss with Jimmy's parent about this prescription? What are some things I should share with Jimmy's mom? Ms. Bravo.
Okay, got side effects, risk of misuse.
Exactly.
How it can help treat the infection, expiration date.
Duration. You all are ready to put on your white coats tonight. That's it. Those are the counseling pearls, y'all. Those are the pearls, the detailed and pertinent information that I have to give to these parents. Very important.
We have someone that jumped in. Can you mute yourself? Thank you. All right, excellent.
Okay, so as far as just going back to the counseling pearls before I get into medication adherence, because that all goes hand in hand. As a pharmacist, whether I'm dispensing it or whether I'm, the clinical pharmacist in the hospital, it's important that people know what they're taking. I see so many patients day after day. I'm on this med, I'm on that med, and they don't even know why they're taking it. Or Jimmy's mom might have been so overwhelmed she forgot the diagnosis. So it's always important that I tell people what they're using this for, what the doctor has prescribed, what strength it is, and like you said, the side effects of the medication, because things like amoxicillin can really cause real bad GI side effects. So I want to let the parents know what to look out for. When should they call the doctor? If it's usual side effects that she can kind of deal with on her own, I would tell her those things. And then we would talk about storage, keeping it refrigerated, when it expires. All those things are very, very important. And then that leads into medication adherence. Next slide, please. So with the adherence, again, we're really, we got it down. We have the medication. The patient has the medication, but if they don't adhere to what the doctor prescribed it for, then everything becomes null and void. So if the dosing directions is 1 teaspoon twice a day, and Jimmy's mom is pretty busy, I'm just going to give him 1 dose a day and call it that. That's not how you get rid of the bacterial infection. And that can lead to resistance. If Jimmy has another infection on down the road, he may become, the bacteria that we're treating can recognize the components of the amoxicillin, mutate into something else, and now the medication doesn't work. So adherence on every level is so important. So taking it until it's finished. A lot of times after 3 or 4 days of taking an antibiotic, the patient starts to feel better. I don't need my medication anymore. That is so not true. Even when you feel better, if the duration of therapy is 10 days, then it's very important that the patient takes it for 10 days. So those are the things that I just stress hard when I have the patients right in front of me, how important medication adherence is. Because again, we're trying to get optimal care. I've given you the right drug. I've given you all the right things, but now it's up to the patient to do their part, which is to take it correctly and for the right frequency and duration.
Absolutely. Just as a quick aside, so for everybody who's in biology learning about the cell wall, and this is where amoxicillin you can have drug resistance with bacteria, right? So it might seem like you don't need to know the mitochondria is the powerhouse of the cell and the cell wall, but you do. You absolutely do, because that's how antibiotic resistance happens. So,
yeah. Indeed. All right. So we've talked about the pearls before, but again, why are they important? And by law, I have to ask you if you have any questions. So if a technician is ringing up the prescription, the money exchange has happened, it is her job by law to ask, would you like to speak to the pharmacist? And when that patient denies counseling, then we do have patient information sheets that have all the possible drug side effects, what to do if an emergency comes up. So we do provide them with patient leaflets about the medication. But when you ask to speak to a pharmacist, it is my job by law to sit with you in a private setting and go over detail of what's been prescribed. So that is required for me, because we want you to be successful with taking the medication. So if I haven't shared that you may get diarrhea, then that means the patient may stop taking it. So it's important. It all goes hand in hand with adherence. And then too, if Jimmy's mom decides she wants to stop after 5 days, keep it in the refrigerator, 20 days later, Jimmy's still affected, she may try to pull out that old expired amoxicillin bottle. So I have to make sure she knows the expiration. If there's any left in the bottle, that has to be thrown away. All of those things help with medication safety, because these drugs can be harmful if they're not used correctly, or ineffective if they're not stored properly or used properly. Okay. So case number 2, we're gonna just give you a glimpse of how to count medication. So our next case will be for an older person. So in this case, Amanda is a 16-year-old female who had 4 days of fever, cough, fatigue, poor appetite. She was seen by her pediatrician, again, Dr. Weiss, and was diagnosed with a bacterial lung infection called pneumonia. She was prescribed 10 days of amoxicillin. So now we're going to walk through how to feel for Amanda, who's an older patient. So in this case, amoxicillin comes in capsules. So by the time you become a teenager, you shouldn't be prescribed a suspension unless you have, esophagus issues where you can't swallow. But when you can use capsules, pills, it's more cost effective to do so. So in this case, Amanda's going to be prescribed amoxicillin capsules, 500 milligrams. And her directions is going to be 1 capsule by mouth 2 times a day for 10 days. So that means she's actually getting 1,000 milligrams twice a day for 10 days. And based on her weight, that would be appropriate. And the indication, which was the pneumonia. So we're going to dispense 20 pills out to her. Again, most antibiotics won't have a refill unless there's a chronic condition that we're using. It's still going to have, a date we prescribed it and the doctor who prescribed it on the bottle as well. Okay. So, terms, do I need to do the actual?
Yep, if you can, you
do the,
have you do the demonstration.
So the demo for this one, I'm gonna need what we call a counting tray. So you'll never see this unless you step foot into the pharmacy, but we're gonna have counting trays, and we use this for counting pills, capsules, and we may have more than one, and we have a spatula. And sometimes we have to switch up different trays because we may have hazardous material that we're counting. So if it's a hazardous material, I'm gonna do that on a separate counting tray than I would a non-hazardous. So you're gonna always see counting trays and spatulas in the pharmacy department, okay? And then your stock bottle of amoxicillin, we're just gonna look at these Skittles, and they're going to be our pills for amoxicillin. So when I count this, I'm gonna put it on the counting tray first and Hopefully you can see that.
If we can lift up just a little bit.
There we go.
Mm-hmm.
Let me go up some more. Can you see it?
Mm-hmm. Mm-hmm.
Okay. So that's the Skittles, if you can see that. And I'm gonna count 20 pills out because they're gonna take 2 pills a day for 10 days. So I need 20 pills. And hopefully you can see me, but I'm gonna actually, we're a busy pharmacy. I can't go 1, 2, 3, 4. Sometimes I'm filling for 180 capsules of a maintenance med. So I got to count fast. So most times in pharmacy, you're going to count by 5. So if you get a job in a pharmacy, please don't go in there counting by 1s. Count by 5s, people. Okay. So here it goes. 5, 10, 15, and 20. And I'm going to close. And I have a spout. The spout of it has an opening, and I put the pills in there, and then I put my top on. And so with this one, it has an easy off top on it because I could have an older patient that can't open, safety caps or child-proof caps. So sometimes I do have to put safety caps on there, but for older adults, I will do this easy off so you can just kind of flick it off when you need to. So that's how you count out pills, counting by 5s and putting it in a vial. And these vials, depending on how many pills you need, how the size of the pill, they come in different sizes, very large vials. This one's pretty small, but they're in drams. So this probably is they come in 30 dram, 15 dram vials, but we do have to choose the appropriate vials as well. And then we just slap on the label, put auxiliary labels like finish all if they're doing it for 10 days. And this will not have shake well since it's not a suspension. And that's how you would do the amoxicillin capsules. Okay? Right?
Do y'all have any questions about the case itself right now? And then we'll do the rest of the QA shortly, but any questions about what we've learned so far? You can either unmute or put it in the chat.
I have a question.
All right. Go for it.
Are there not like counters?
Jayla or Layla? I'm sorry, I see 2 people.
Layla.
Layla, okay.
Are there counters or not counters, but like things that can count the pills already for you?
Yes,
you don't have to
indeed.
do it?
Yeah, and I've worked in a lot of different pharmacies. I've worked in pharmacies that dispense, 1,000 to 2,000 prescriptions a day. So the busier your pharmacy is, the more automations you're going to have. And we have something called the top 100 drugs. So the drugs we most often fill will be in those type of machines where you put in, you need 30, it dispenses you 30, and they're very accurate, but you're going to use those in high performing pharmacies. Most of the time, the ones on the corner drugstores, community pharmacy, if they're not a very busy store, you're going to have people manually counting those. And also the drug manufacturer, the way they make their bottles, because they know it's common to use 20 pills or 30 pills, they will package it for 20 or package it as 30, where all we have to do is slap a label on it. So it's a lot of ways you can do it. I'm just showing you a common way that we dispense, but they do have them pre-packaged for the right amount as well. Great question. Any other questions?
If the pills get mixed up, how do you differentiate them, or do you throw them all away?
Okay, that's an excellent question. That will be called a misfill. And that's part of my job day in and day out, is to catch errors. But, due to automation and technology, we can minimize misfills. For every active, prescription bottle on the shelf, it's going to have a barcode on it. And most pharmacies have high-tech systems where they can scan the barcode before they actually use the pills. And if that barcode is correct, that means they have the right drug and they can proceed. If they pulled the wrong drug, then there may be an error message prompting them to choose another drug. So there are ways around misfills, but when you do that, you don't necessarily get on the person that's made the mistake. You want to look at your system. How did this mistake happen? And so we try to figure out how mistakes happen. But errors, I mean, if you're doing 1,000 a day and one of them got mixed up, then that's you can't just kill yourself over it, but you do have to make sure you understand why it happened. Does that mean the technician skipped scanning the bottle, or did they have too much on the counter? So we do have to figure out what happened. So if it doesn't leave the pharmacy, then we're able to, restock it and just dispense the right thing. But once it leaves the pharmacy, then patients will call us back, asking about their medication and what they did or didn't get. So that's why counseling is important. And when I counsel, I also may take a pill out and show it to the patient so they can know what their pill should look like. So it's just a lot of ways around it. You can catch it at the very end when I visualize. I can catch it when I'm counseling the patient, but there are checkpoints throughout the whole process to prevent those things from happening. Yeah, we take that very seriously.
Great question. There's another great question in here. How are medications organized at the pharmacy?
Okay, so everything, most of the time we're going to have, like I said, those top meds that we use all the time. That's going to be the closest thing to us. So maybe the top 100 drugs may be all in alphabetical order next to each other. After those, you will just start from A to Z. Everything is in alphabetical order from there.
Okay, we're gonna keep going. Well, we'll take this one question. How do you feel about homeopathic remedies? And then we'll keep going.
That's a great question. That's more of a very specialized area that you can kind of specialize in. But most of the times with prescribed medications that are FDA approved, they go through clinical trials to show that they're safe and that they're effective. And a lot of things that are in homeopathic in nature, they may not go through that rigorous process as would your FDA approved drugs. So say for instance, I put you on something natural, but then you're also on prescription drugs too. There could be an interaction that, that we don't catch because those homeopathics aren't, studied with prescribed drugs. So you have to be careful. Most of them are safe and they can be effective, but when it comes to the efficacy of it and the safety profile of it, it hasn't gone through that same process as an FDA approved drug.
So that's a great point that you brought up. And I know a lot of people know more about clinical trials now because of the COVID vaccines and speaking to the FDA or the Federal Drug Administration, clinical trials are a pretty long process, right? So they start out in like the cells in petri dishes. Before then they move to animal models, and then they move to larger animal models, and then they move to healthy adults or healthy people, and then they can start to differentiate. A group takes the medicine and a group doesn't. What happens? They study the side effects. So this is a whole stepwise process that happens in what's called a clinical trial, and there's a lot of rules around them. But like you're saying, the homeopathic drugs don't have to go through that same process. And I've had instances where a patient will take a homeopathic remedy. Matter of fact, last week I had a patient that took an herb from another country and developed a rash all over his face. And so he had an interaction with the cream that we prescribe,
right,
trying to do both things. So it happens all the time.
Yeah, I had a case like that too, because I deal with people that have chronic conditions like hepatitis. And I just sometimes have to ask them, while you're on this drug for 8 weeks, can you not take, some of those homeopathics, because we don't know how it's going to affect this drug. So drugs are studied based on a certain setting. So if you have another medication coming in that it hasn't studied with, it can compete for absorption. It can compete for breaking down into your body. So they can compete with each other. And then the effectiveness of the drug declines because it's competing with something that hasn't been studied with them. So it can affect how medications work. Not that I'm anti-homeopathic. I just feel like you have to kind of have a profile of a person that's not on a lot of different medications. They don't have a lot of chronic diseases. That way it won't run the risk of working against the prescribed medications.
Mm-hmm. Absolutely. A lot of doctors and pharmacists and nurses also see the value in those natural herbs too. We just have to be really, really cautious and triple check. So
exactly.
Great questions.
Thanks for asking.
Mm-hmm.
Any other ones?
Not yet. We'll go back to our Q&A after go through our key terms here.
All right. So key terms that we've talked about today. I know I've given you all a lot of information, and one session truly is not enough. So definitely just some key things, the takeaways to take with you. Drug allergies, knowing what they are is very important. The dosage form, what type of prescription it is, if it's suspension, IV, subcutaneous, which is under the skin, if it's oral, by mouth, all those terms make a difference. Short term, short codes like BID, QID, as needed, that means PRN. How often a drug is taken, those are key points that I have to know as a pharmacist. How long to take the medication, because if my patients aren't taking it long enough, then we're not, eradicating or getting the full outcome that we're looking for. Then side effects. Side effects is a main reason why people stop treatment. So they have to be aware of these side effects. We have to help them maneuver around it. And if it comes to a point where it's overwhelming or too much for them to handle, sometimes the first prescribed drug just may not work and we have to switch it to something else. So constant communication with side effects and making sure the patient is okay during the process of treating is so important. Medication adherence, again, taking it as prescribed, for the duration of time and for the right indication, all that is important, and that helps with the medication safety of the drug so that we can get the clinical outcomes that we want.